MedShake.
Hi, I'm Anca, and this is the place to be to hear about the latest tech trends in healthcare. Today, we are seeing a growing trend in how we access healthcare, one that is being reshaped by artificial intelligence and the consumer-first approach of tech giants. More and more, companies like Amazon and Google are integrating healthcare services directly into their platforms, bypassing traditional hospitals and clinics. For example, Amazon's telehealth services now allow users to consult doctors and fill prescriptions as easily as ordering household items. This shift raises important questions. Are we witnessing a fundamental transformation in how healthcare is delivered? What does this mean for traditional healthcare providers and for us as patients? In this episode, we'll analyze this trend, explore its implications, and see what we can make of it. Welcome into the MetaHub. For decades, healthcare has been structured around hospitals, clinics, and insurance companies. The traditional model is slow-moving, heavily regulated, and in many cases, inconvenient for the patient. Long wait times, inaccessible specialists, and bureaucratic hurdles have led to frustration and disengagement from the healthcare system. Beyond inefficiencies, many countries are facing an even greater crisis. Their healthcare systems are simply unsustainable. There is a growing shortage of doctors, and the demand for healthcare is outpacing supply. The aging population, along with the risk of chronic diseases such as diabetes and cardiovascular conditions, is placing unprecedented strain on already overburdened systems. If the trend continues, we risk reaching a point where there are more patients in need of care than healthcare professionals available to provide it. This imbalance means that the traditional healthcare model is struggling to meet modern demands, forcing the industry to explore complementary models. AI-driven direct-to-consumer healthcare is one of the most promising alternatives, offering scalable solutions to bridge the growing gap. But will it be enough? And what are the risks of shifting so much responsibility for healthcare delivery away from traditional providers? Direct-to-consumer healthcare is, in essence, a model that skips the traditional gatekeepers. Companies like Amazon, Google, and telehealth providers are creating an entirely new patient experience, one where medical care is on demand, AI-driven, and directly integrated into our digital lives. But this is not just about convenience. Direct-to-consumer models are heavily based on digital solutions, leveraging AI and data-driven insights to reshape patient care. Ideally, this transformation will help address the growing demand for healthcare while also covering the medical black box that exists between doctor visits, those very critical moments where patients are often left without guidance. With continuous monitoring and real-time insights, these models can bridge gaps in care, ensuring that patients receive ongoing support rather than sporadic attention only when they visit a clinic. Additionally, AI-driven healthcare has the potential to push forward preventive medicine, helping individuals take action before conditions worsen rather than reacting to illness after it emerges. So this is where the real value of direct-to-consumer healthcare lies, creating a system that is proactive rather than reactive, personalized rather than standardized, and always accessible rather than episodic. As I was researching this topic, I came across a fascinating paper discussing this very shift, and I found some particularly interesting insights that I want to elaborate on this episode. Large language models and predictive AI are increasingly capable of diagnosing conditions, recommending treatments, and even identifying health risks before symptoms appear. But while hospitals and traditional healthcare organizations have struggled to integrate AI due to regulatory and operational challenges, direct-to-consumer companies have no such constraints. They move fast, innovate freely, and often sidestep the rigid infrastructure that slows down legacy healthcare institutions. This has led to the emergence of AI-assisted consumer healthcare, where patients can receive automated consultations, prescription recommendations, and even mental health support through AI-driven apps. For instance, a company like Amazon can integrate AI into its existing telehealth and pharmacy services, allowing users to get instant medical advice, order medications, and schedule follow ups, all without setting foot in a clinic. This is not a hypothetical scenario, it is happening right now and it is growing rapidly. One of the reasons we see tech companies at the forefront of this healthcare shift is because they possess a uniquely valuable asset: data. One of the most critical shifts happening in healthcare is the movement of health data away from traditional providers and into the hands of consumers and tech companies. Apps like Apple Health, for instance, already allow users to download their electronic health records, integrate them with wearable data, and analyze patterns using AI. This means that a patient's medical history, genetic data, and real time biometrics, and even social and environmental factors, can be combined to create a more complete and personalized health profile than any doctor could ever manage manually. Big tech has also another key advantage: they control their data ecosystem. Unlike hospitals that rely on third party electronic health record vendors, companies like Google, Apple, and Amazon own their data networks. They can use real time testing to fine tune their AI models, rapidly iterating on healthcare solutions in a way that traditional healthcare providers cannot match. The rise of AI driven direct to consumer healthcare does not necessarily mean the end of traditional healthcare systems. On the contrary, the question is, will hospitals and clinics embrace these innovations and integrate them into their models, or will they resist and risk becoming obsolete on some aspects of care? Some healthcare institutions are already developing hybrid models, blending AI driven virtual care with in person interactions, and I believe that this is the way to go moving forward. Meanwhile, some direct to consumer companies may shift towards hybrid models as well, recognizing that AI alone cannot replace every aspect of human healthcare, as we have so largely discussed on this podcast. The future of medicine may not be purely AI driven, thank God, but a combination of AI assisted care, traditional in person services, and consumer driven health data management. What is clear, though, is that patients are no longer passive participants in healthcare. They expect the same level of efficiency and personalization from their medical providers as they receive from Netflix, Amazon, or Google. If traditional healthcare providers fail to meet these expectations, the market will find ways to bypass them. That's it for today. Thank you for listening, and as always, I will see you soon for another tech adventure in healthcare.